This is week number 16 in a radio series on mind control. And to summarize what we've heard so far, we've heard several shows laying the foundation of the documented reality of U.S. and Canadian government-sponsored mind control. We've also heard the accounts of some survivors, such as Claudia Mullen, Chris Ebner, and Ronald Howard Cohen. Claudia Mullen is alleging that CIA doctors such as Martin Orne, Sidney Gottlieb, and L. Wilson Green experimented on her in childhood using drugs, hypnosis, sleep, and sensory deprivation, radiation, and physical, emotional, and sexual abuse. Claudia is also alleging that Canadian doctor Ewan Cameron from McGill University in Montreal was involved in the mind control experiments on children as an electroshock consultant to the CIA, shocking the child victims after experiments or operations to make them forget. Claudia has also told us of being used as a mind control sex slave for the U.S. government, being set up in sex situations as a child with military brass, politicians, and other officials, while the CIA videotaped them for blackmail and coercion purposes. We've heard the historic testimony of mind control experiments at the presidential hearings on radiation experiments in 1995. The final report of that hearings included recommendations to declassify all information related to the mind control experimental programs. Today, we are going to hear a presentation by Valerie Wolf, given at the Believe the Children conference in April of '97, entitled Assessment and Treatment of Survivors of Sadistic Abuse. Valerie Wolf is a therapist of Claudia Mullen, both of whom gave testimony of CIA mind control at the radiation hearings. In this presentation, Valerie talks about her approaches in helping to heal mind control survivors and the techniques used by the CIA to control their victims. This program, which continues next week, is of particular interest to the therapy community that are dealing with survivors of mind control, ritual abuse, and trauma. And just to explain a term that Valerie uses at the beginning of this, she refers to EMDR, and that means eye movement desensitization and reprocessing, which is one therapy technique. You're listening to CKLN 88.1, and now, Valerie Wolf.
I am going to talk today about treatment of mind control. I'm going to start with grounding us in good therapy practice in terms of the model of treatment, which is now called stage-oriented trauma treatment, which is becoming the standard of practice for trauma therapists, because the way that I work with mind control, I think, is different from some of the approaches that I've been hearing about, because when I first heard about this in June of '92 and started working with it in September of '92, I essentially worked in isolation, totally by myself. I had nobody to talk to except my clients until we testified in Washington in March of '95, and then the world opened up. But up until that point, I had worked pretty much alone with mind control and a lot of with the SRA clients. So I sort of developed it out of what I knew, which is the therapy model. And I have spent the last couple of years trying to figure out what it is that I was doing, because what I'm finding is my clients are getting better. I have several clients that are through the process, and all of my other clients are just absolutely phenomenally better. I've also been providing consultation for some therapists, brief consultations for some therapists in Louisiana and across the country. And when they apply the kinds of things that I'm going to tell you today, they have the same kind of success with this extremely difficult population. So we're going to start with assessment, and I'm going to talk about assessment in terms of mind control, and that's an ongoing process. Always you're making assessments about what's going on with your clients. And then second stage, safety and stabilization, and this is really 80% of the treatment. Then trauma metabolism, which is the memory work, and trauma resolution. And then when I get finished with this, I will go back and talk specifically about treatment of mind control and how I conceptualize it in a way that makes treatment effective. Okay, in the assessment, you do standard intake procedures. You want to know what is the thing that brought the client into treatment. Recently, I did a consultation for a psychiatrist, and a woman came in to my office, and I was asking her what it was, why she was coming. And the psychiatrist wanted me to use EMDR because I am trained in doing EMDR. You cannot use EMDR very well with mind control clients. And she said because she had a fear of doctors and going to doctors' offices. I pursued that a little bit, and we got into talking about some of the things that doctors did. She had some memories of doctors hurting her, and as I began to inquire more and more, this woman turned out to have mind control. One of the things you want to look at are current symptoms and functioning, and that's really important in terms of any kind of sex abuse. You know, most of the clients come in with depression or anxiety or some kind of behavior, suicidal symptoms. One of the primary things I look at when clients come in are their primary relationships, because I know that however a client has related to parents or significant others in their lives, that's how they're going to relate to me. That's a real clue. Also, if there was a nurturing person somewhere in their background, because one of the things I'm assessing for all the time, and understand that I get really difficult people referred to me. I have always ended up with clients that no one else wanted to treat, which is, I guess, how I kind of stumbled into this area. But I know if I explore previous relationships with other therapists, I'm not so arrogant as to think I'm going to do any better. I know the same things are going to come up with me. And I'm prepared for it. The other thing I look for is the ability to attach. And this is so important with all of this client population, and that's beginning to come out in the literature, because if you are going to be involved in a prolonged, deep therapy relationship, and if people are going to be able to sustain the kinds of work that they're going to have to do, they have to have the ability to attach. And I have to feel the attachment as well. And that is the thing, the connection that sustains the therapeutic relationship through a lot of really, really difficult work. And I have had clients who are unable to attach. And basically what I have done is referred them on to other therapists. But that is a very, very important thing. And what you find is a lot of these clients can, for whatever reason, even though they've had horrible abuse throughout their lives and cannot identify anybody in their background, there is a drive with children to attach to people. And sometimes even the attachment to the perpetrator, even though they would get abused, even the attachment to the perpetrator can serve a positive thing. Because if you can attach, it makes things easier in terms of jobs, making relationships with people. And so I'm really emphasizing that because I've found that is probably the single best predictor of good outcome in therapy, is that ability to attach. Forming the therapeutic alliance. Want to look at addiction issues, and I'm going to do this real quick because what I'm giving you is a workshop that I did in 7 hours 2 weeks ago. Addiction, victimization as adults, because we know that when people have been sexually abused and abused as children, and if there's this severe sadistic ritual abuse or mind control, that they tend to be re-victimized as adults. You don't often get told about that, so you need to inquire about it. Ask them if they are crime victims. That's not something that we standard ask people, but that also is important because that's another part of victimization. In fact, some of my clients say that what has happened to them is a crime and they are crime victims, which is true. Any other trauma that has happened, like death, divorce, and how they manage those, because that also gives you a clue as to how the therapy is going to go, whether they have committed crimes. Because sometimes, and again, this is ongoing, but sometimes what I have found is that some of my clients who come in identified as victims have in fact perpetrated with children that they have babysat in adolescence, or they've done shoplifting, or they've done other things. And that's a source of deep shame. And you really want to know about those things at some point in the therapy in order to help them work through that. Their legal history. And unfortunately, in this day and age, we have to be aware of lawsuits, whether they have a current lawsuit, whether they have a previous lawsuit. And this isn't just lawsuits against therapists. but any kind of law, like for an accident or whatever, because the litigation process produces certain kinds of effects. And if they ever decide themselves, and the therapist should never suggest a lawsuit, but if they ever decide to go through one, sometimes their experience with a previous lawsuit will determine that. Or they may have access to the information. And it's important for you to know and to document if they've been through a lawsuit before. If there's suicidal ideation, self-mutilation, self-destructive behavior, a lot of this is hidden. People, if they're cutting, will cut on the inside of their thighs or parts of their body that you can't see. In fact, how I started really treating mind control specifically is I had a client who had carved an upside-down cross in her chest. And it was like, she had all the earmarks of what I had been told about, and I went, well, I guess I better try this, because she was headed for the hospital. Self-destructive behavior. One of the ways that you can pick up on and begin to think if you have a mind control victim or a sadistic ritual abuse victim or a survivor is that if you get I have to die, I have to die, I have to die, compulsive behaviors, compulsive thoughts of suicide, compulsive thoughts of self-destruction, and on the other hand, they are lucidly saying to you, I don't understand why I'm thinking this because I really don't want to die. I don't understand why I'm doing these behaviors, but it's like something comes over me and I just have to follow through with it. When I hear that kind of compulsion kinds of stuff, then I begin thinking about maybe that's what we have here. You want to look at their current support system. And this is really important because if they have a current support system, then that means there is not going to be so much pressure on me, the therapist, to provide that support system. Because what I want to do is to have another set of either friends, spouse, somebody who's out there so that everything isn't dependent on me in therapy. Unfortunately, one of the things that happens is that as people get better in therapy, they realize, and this is a real loss issue, they realize that many of their friends were picked out of their dysfunction. In fact, I have a client that's going through that right now, and she has basically dropped all of her friends that she thought were really good friends because the kinds of relationships that she had were, she was the helper, always doing stuff, always at her friend's beck and call, and they were extremely narcissistic and demanding. And now that she's healthier, and she's a mind control victim, and now that she's healthier and she can see this, she's extremely lonely, and she's beginning to build new and healthier relationships. So even the best laid plans in terms of building a support system don't always endure. So you need to be aware that that's going to happen sometime down the road. Knowledge of memory and trauma. You want to ask, what do they know? And if someone's coming in with memories or at the point at which they start remembering things or revealing to you that they were abused, you want to find out and document what have they heard in the media, what have they read, what do they know, who have they talked to, and document this. And you want to know what their impressions are about memory and their information. And this is really important because if people are reading books and whatever doesn't necessarily mean that that's causing the memory. It could be triggering memories, but you also want to begin to develop a list of triggers. So not only for protection in terms of educating them about memory work and memories and what goes on in therapy, but also because you want to begin to identify triggers. And there are a lot of triggers in the media. And it's really important for you to begin to take note of that. And then you ask, is there anything else significant in your life that you want me to know? And this is a question we sometimes don't ask. I mean, I remember a very long time ago, I had a woman in therapy. She was a survivor. And we got to the end of therapy, and the very last session was planned, and all of a sudden, in the session, she reveals to me that she'd had an abortion when she was 19. And I'm sitting there thinking, what do I do now? She went into an intense abreaction of the event, And so what I did is I reframed it into, thank you so much, what a gift that you have shared this with me. And she informed me that's all I needed to do. I just needed to tell you, I needed to remember, I'm fine with it now. And she really was. But I have now started asking for that information a little bit earlier, more for my comfort, so that I don't get surprised at the end of therapy with something. But there may be things that they're not telling you. And again, this is an ongoing thing, all these kinds of questions, always thinking about. Another part of the assessment is if you're assessing, or you started getting the compulsive kinds of ideation, you're starting to get the message kinds of stuff, you want to assess also the kinds of things that they're telling you as a therapist. One of my clients that I'd had for about 2.5 years, I had no idea there was any mind control in her background. All of a sudden, one day came in and lambasted me from up one side and down the other. She was really angry with me. No real specified reason. I was just in it for the money. I really didn't care about her. I was just like every other bad person in her life, on and on and on and on. And that was when I first began thinking about her, that maybe there was some mind control here. And sure enough, there did turn out to be. So what you want to look for are those kinds of flooding messages or therapist messages in terms of picking up. The other thing you want to do in assessment of a mind control survivor is to look at body pain. There are real specific types of body pain that show up. Headaches, specifically around the temple, that feels like electric shock. Body pains all over the body. Pain in the mouth and the teeth. Pain in the face and the jaw. Pain in the ears. Or like one of my clients was talking about, always hearing a radio just below the threshold of hearing. And what that is where they put a recorder in the ear. In the right ear, in order to disable, this is the theory, the left brain, they would put pain or a sound. In the left ear, to go into the right brain, which is not reasoning, it's a creative part of you, they would put messages. And they would be whatever, you have to die. One of my clients had this whole elaborate set of ritual abuse instructions of, in the full moon on the 3rd day of September, you have to go and get blood and drink blood and put needles in your arm. And sure enough, we found out cyclically that she was putting pins in her arm at certain times of the year, and there were actual messages. So what you find is that kind of things in your ear, being choked, other kinds of body pain. A lot of these clients have been to doctors, many, many, many doctors, and with exploratory surgeries and other kinds of surgeries that find nothing, because some of the symptoms mimic other diseases. And the body pain I have found with the mind control survivors and the SRA survivors is more serious than with people that don't have those kinds of histories. But, so you want to go through whether there's pain on the tips of the fingers sometimes, or how are they sleeping tonight, at night? Mind control survivors tend to wake up every 2 hours, or on some schedule of waking up at night, like every hour or every 2 hours. And I'll talk about why that is. So those are the kinds of things that you begin to hear. And then when I begin to hear those kinds of things, and some of the symptoms and whatever, one of the questions, and I'll start just asking questions. And one of the questions that I'll ask is, if there were a doctor involved with your abuse and his name were a color, what would that be? Typically what you get is red, black, and then green. And if you get Dr. Green, it's Dr. Green. And every survivor that I've ever talked to will tell you Dr. Green. They may also give you a bunch of other colors, and then at the end they'll say, okay, green. Or I had one client, the one that came in and lambasted me that day, and I started asking those questions. 6 months later came into therapy and said, well, all right, I'm ready to talk about it now. It was Dr. Green, and I knew that's who you were asking about, but we weren't ready to deal with it yet. So that's one thing that you can ask. you can also begin to ask more specific, depending on what they're telling you. And the approach that I have used and what I have done is I have really listened to my clients. Really listened to them. They direct the treatment. In the assessment phase, when we're making the contracts at the end of the assessment and we're making contracts about how we are going to work in therapy, my contract with my clients is that they are responsible for their therapy. That I don't know specifically, and I do this with everybody, specifically what happened. They have to give me information in order for us to work together. My part of the contract is to make sure that they're safe, to help them design interventions to deal with whatever it is. But it's basically, and to be supportive, and I remember everything that I'm told. I have a really good verbal memory, and so to remember, so that we can make connections to things that otherwise they wouldn't be able to make. And that's my part of it. Their part of it is to talk or draw, because not always can people communicate verbally. And if you think of the mind control survivor whose everything is right brain, and with DID, people with DID, what you're getting is a lot of right brain communication. They don't tell you directly what's going on. They drop a lot of clues. In fact, one of my clients describes it as the game of Clue. Colonel Mustard did it with the knife in the study. And it really is kind of, with her, that's exactly what it's kind of like, is that I have to kind of help her put it together. So you have a lot of right brain, also a lot of hypnotic trance communication, which is different from logical conscious communication. Trance logic, A does not go to B, does not go to C, and you have to understand that something you may be being told may not make sense to you, but it does make sense to the person telling you. Okay? But anyway, so my contract is, and I listen, basically my clients tell me what to do. I don't direct the therapy, except to keep them safe. Somebody's cutting or self-mutilating, I jump up and down, and sometimes I get really angry, and we deal with that, and I'll tell you another way of dealing with that works really well later. But, so anyway, that's, if you get nothing else from this, and I hear from people all over the country, and the most common complaint I hear about therapists from people all over the country is, my therapist isn't listening to me. My therapist is telling me that I'm resistant, that I'm uncooperative, that I'm not following the program. Well, that tells me the therapist is directing the treatment. And in the case of mind control and SRA, I firmly believe with all of my clients, they know what they need to do to heal. And I have never been disappointed about that. Okay? And so I listen. And if you get nothing else from this, this is really important. In fact, I was talking to a woman the other day who was looking for a therapist, and what she had done is she'd always gone in logically, left brain, and picked a therapist who was experienced and knew stuff and whatever. And I suggested to her, she's DID, I said, why don't you let your system pick the next therapist? She left me a message and said an hour later, this name floated to the top of her mind, and she went to go, that's the therapist that she felt was really intuitive, and she realized that she'd been picking people with the left brain, and she needed someone who could intuitively hear, who was also able to understand right brain communication. Okay? So, you can put the next one. The other thing, and I'm just throwing this up here, but I think it's really important also to do a differential diagnosis. These are some of the typical diagnoses that get attached to our clients. And most of them, the one that I have found that most commonly, or there are a couple in here that get confused and people begin thinking there's sex abuse when there may not be. The most common one's obsessive-compulsive disorder. I'll give you an example of that. I had a woman who came in, I've been seeing her a while, treating her for OCD. She came in and said, oh my God, I had a nightmare last night. that my father sexually abused me. Well, there was nothing in her history or behavior to indicate that that was the case. And so we did some very careful, I asked her, what is that connected to in your past? And what she remembered was that when she was 13, she picked up an article in the newspaper, and it was an article about a child being sexually abused. And her thought went to, oh my God, what if my dad does that to me? And started imagining what it would be like. And then her anxiety went way up, and she started ritualizing it, but she never metabolized it. So this thought had been ritualized, and every time it came up or she got triggered, she would start ritualizing against this imaginary. It really was imaginary. And what ended up happening is when she realized she'd read the article and what happened, then the anxiety went down, and she realized that she had not been sexually abused. So I think a really good differential diagnosis is good. Borderline personality disorder I consider to be a perfect description of survivor behavior. If you look in the DSM, what you will see is everything that we talk about is characteristics of sexual abuse, if there is such a thing. But it really, to me, it seems like, and when I treat it like that, it's much easier. I don't get frustrated with all this, quote, borderline behavior. Yes?
Can you give just a real simple explanation of most of these things?
Okay. Paranoid is when you think people are out to get you. Schizoid means that you absolutely do not react to anything. That could be a dissociative response. Schizotypal is another type of disorder where you don't react to stuff, you don't have relationships, not a lot of feeling. Antisocial is the people that commit crimes who have very little feeling or affect and basically are out for their own good. Borderline, as I said, are people that have shallow, frequent move from relationship to relationship, have very intense relationships. They'll have an intense relationship with the therapist, but really fear intimacy. Histrionic is someone who's hysterical and always emoting all over the place, but again, that can be a dissociative response. Narcissistic. Let me just say a word about narcissistic. What I have found is a lot of survivors look very narcissistic, and that means very self-centered and everything for them. I had one client who every time she went to see her psychiatrist, after a while the psychiatrist said to me, where the hell are you in this therapy? And what was happening was is she would go in and tell him all these things that she was doing in therapy. Now, I was working my butt off. She was mind control, but it was like I didn't exist. And she came across as extremely narcissistic. When we got to the bottom of this, what it turned out was she had a lot of suicidal programming and a lot of body pain, is that she was so focused on her survival and what she needed to do to stay alive, she had no energy or room for focusing on others. And that happens with our clients. Now that she's through the process, she's not narcissistic at all. Okay? So what I also caution people about is if you're looking at narcissistic behavior, check to see if maybe there's a deep-rooted survival thing going on there. Because if people are surviving, you better believe they're narcissistic, because that's all that exists if it's basic survival. Avoidant is avoiding people. Dependent is dependent on others, not being able to make decisions. This could be one of the things that you see with mind control. A lot of my clients very dependent on their perpetrators still, or dependent on other people in their lives, can't imagine making decisions on their own. And a large part of the treatment process is teaching people that they have choices. Okay? A large part of that. And that they can make decisions. But they'll fight you on it. Obsessive compulsive is when people do rituals, or they like the hand washing, but it can be more subtle than that. Counting in your head. Now, I have a mind control survivor who counts in her head who's not obsessive compulsive. It's a memory. Okay, they made her count backwards or count forwards every time they put her in trance. So whenever she switches, she counts forwards or backwards. Okay, and she read something about obsessive compulsive and came in saying, I'm obsessive compulsive. she was not obsessive compulsive. She is not. Passive aggressive is by inaction, making other people mad, and being aggressive through not doing anything, sitting like a lump. Some of these kids in the mind control experiments, I have 2 that were dropped at the age of 6 or 7, and the reason was because they became very passive aggressive. They still have the problems, a lot of the problems, because they did a lot to shut them down. But basically, the best, what do you think the best way of fighting them, not the best, there are lots of ways, but one way of fighting them is to comply, but not really. Okay? I have one client that pretended she was stupid. I don't understand what you want me to do. And no matter what they did to her, she never understood what they wanted her to do. Ways of fighting. But that's passive-aggressive behaviors. Again, this is survival sometimes for mind control survivors. Eating disorders are very common. Anorexia, not eating, bulimia, throwing up. And as part of the mind control, they actually deliberately tried to induce eating disorders. Okay? And I have clients on both ends, both anorexic and overeating, and really messed with that. Post-traumatic stress disorder, again, intrusive thoughts, flashbacks, just the stress where the trauma keeps intruding on the current life. Dissociative disorders, and there's a whole continuum of dissociative disorders, from post-traumatic stress disorder, where you can just kind of go numb for an event or something that's happening, to what's called NOS or dissociative disorder, not otherwise specified. And there's a continuum here, too, that I'm seeing, and that is there are people that have, like, ego states or feelings that they split because they couldn't feel the feelings when they were being abused. But there are also people who have altered systems who are not quite as fully developed as someone with full-blown DID, okay? And what you have are the parts inside may have names, but they don't take over the body in the same way. The core birth personality is co-conscious. And what the parts do is blend, okay, because parts can blend. And that's a lot of what we see in terms of behavior, is parts blending that have jobs. And I'll talk about that in a minute. But a lot of the clients I see with mind control are not full-blown DID, dissociative identity disorder. Some of them are what we have been calling fuzzy DID, because it's not real clear and it's hard. It's not discrete states that actually, however they do it, they're more fragments, holding memories and feelings. Now I'm going to talk to you really quickly about DID, and I'm just going to tell you, I'm not going to go through all this, but I'm just going to tell you how I understand DID, because if you're working with mind control or DDNOS, this is what my clients have told me. This is what I've heard. And I've talked to some of the survivors here, and they tell me that I really understand. So I'm going to pass this on. First of all, you have the core birth personality. Core birth personality is generally the part that is the age of the body. It is the part that, if all the parts were to integrate, that's who they would integrate with. The core birth personality is not that baby inside who did not develop. Okay? It is actually the one that is the age of the body. It is really important that you know who the core birth personality is in a DID system, because that's who you have to work through. That's who has to get the memories back. That's who has to construct a safe place and do the work, because if the core birth personality doesn't do it, it won't stick. And why is that? The reason is because all of the alters or the parts or the kids in the system were created by the core birth personality. Kids do not, or parts do not create parts. The core birth personality creates every single part, and they are created to have a job. Their primary job is to protect the core birth personality, to allow that core birth personality to grow and develop and be able to function while they take the pain or the trauma or the feelings or whatever. So the core birth personality is really the central part of the system. Now, if you have the concept that every part has a job, and they do, that means there are no perpetrator alters. And this is so important. What happens is, even if an alter comes out and cuts, they think they're doing their job and protecting the core birth personality, no matter what the behavior. The answer to them is, you did a wonderful job. Too good a job, but a wonderful job. Now you finished that job, you've done it so well, you don't have to do it anymore. And now you can have another job, and they will take new jobs. It's a reframe, but it works. And this you can get through. Sometimes I do get upset because what I try to do is get through the system, no hurting the body. I mean, we do talk a lot about that. But if you conceive of it as a job, then you can praise them, you can give them A+, and they can graduate to the next grade or graduate to the next level. And this really, really works. Also, it doesn't matter what behaviors they're doing. Now, in mind, this is any DID system. In mind control, the researchers knew about these parts and gave them jobs. And so the jobs they were given were things like calling them, keeping in contact for later. They also had jobs to carry out whatever their job was, if it was a sexual job or a courier or an assassin. But they were taught and given specific jobs. Okay? So, again, it's the same response. You've done such a good job. And what you find is they're really willing. A lot of times they're really relieved. Sometimes you have parts that mimic perpetrators. There are a lot of Dr. Green parts. They are so relieved. How do you get them convinced that they're not the real perpetrator? All I do is say, think back, and what position are you in? Are you being hurt or are you hurting? And they think about it, and all of a sudden you get crying, I'm being hurt. Then you can't be this person. You can't be the perpetrator. And it's a really quick way of turning somebody, and then they take another name and go inside or go to the safe place or whatever. So these are the concepts that I work with that have been really, really useful for me. And they also work with regular DID clients. But I think it's real important for you to understand. You can put that next. Okay, safety and containment, or safety and stabilization. This is the majority of the treatment. Again, working on establishing a therapeutic relationship. With DID, you have to continuously establish a therapeutic relationship as you get different parts of the system. Now, developing an internal safe place. This is really important, and this is a central piece of containment for mind control and also for DID and severely abused people. Basically, we'll start with talking about a safe place. What do you do if someone says there is no safe place? My answer to that is, oh, come on, there's a secret place inside that nobody knows about and nobody can get to. That's the place I'm talking about. And you get this little grin, and it's like, yeah, you're right. So it doesn't, if the word's safe, because sometimes they're told there's no safe place, you can say secret place. There are certain elements that need to be in the secret place. It needs to be inaccessible by anybody, including me. It needs to be, and what I do is give sort of suggestions of elements, find out what's there, find out what makes it safe, where it is. I mean, you know, basically is it mountains or clouds or whatever. If they don't have one, I'll ask them where they want. But they need to clear where, even if they haven't already established safe place, because a lot of people do, is you have to clear a football-sized field around. And then I ask them to put walls of water light around the outside. Water light that nobody can get through and makes it invisible. And the reason why you want the football clear field is so you can see if anybody's coming. What also you want, and now not everybody does this, I'm just giving you the elements that have been useful to people. Then you want to construct a building or something, shelter of some kind in the center. And in the shelter there needs to be a swimming pool or a healing pool. And for some people they want it partly in the house and partly outside. This is incredibly important for mind control. And the reason it is because did you know that water dissolves the crap off their bodies? And I said that to one of my clients and she said, oh, that's why they didn't want us to cry. And so I use that now and I say, and it's true, water will wash off and dissolve because it did. If there are electrodes and there's gunk put on you, what did they wash it off with? Water. So water washes the stuff off. There's an association there. Okay? The other thing, it would be useful for some people is to have microwaves. If you have some of these mechanical things, the robots. Actually, what they did is they took kids and packed them inside these big things that look like robots and put them inside and then did all kinds of stuff to create parts or make the core create parts. They don't create parts. The core does. And then what you do is if you encounter one of those contrivances, you can disable it with microwaves. You can also, there's a switch on it somewhere, turn off the switch, take off its head, get all the kids out of there. Get all the kids out of there. They'll show up in the safe place sometimes. So you also want to have a nursery for the very little ones with cribs. You want to have food, you want to have toys, and you want to have an infirmary. Because there are going to be kids that you're going to be uncovering that are absolutely wrecked, that need to be healed. And so they need to have a place. And you have helper altars inside. And I'm sorry, I'm just going to use the word altars or, you know, I know some people don't like that. But they have helper altars inside that help and take care of the kids as they come up. No doctors and nurses. Okay, it's important. Or unless they want them. One of my clients has Beverly Crusher in her tricorder. It's an interject. Okay? Because who comes and runs the tricorder over everybody and heals everybody. So they can also produce interjects that they know are not, but it's part of the imagery because they're very, very good at imaging. Grounding techniques basically are based on changing the senses. One of the most effective ones is changing the sense of smell, carrying something with a little perfume that's soothing, or the sense of touch. All my life I have had this sense in my fingers that I think about. It's silky and bumpy. And I never knew what that was. And I always think about it when I'm in periods of stress. I feel it in my fingers. It's a body memory. And then when my son was born 20 years ago, and I got his baby blanket, it's a chenille baby blanket. And I didn't remember what that was. But to get them connected to some kind of touch that is soothing. To change, if they start to go into flashback, to change the senses. It's really important. Another thing, one of my clients was at the doctor's office and started to go into flashback and asked them, they were running around trying to get her ice. Because if you put ice in your hands, it hurts. And it's kind of like cutting, but it doesn't do any damage. But it's a change of senses. That's why people cut. Because you can focus on the pain and it gets you away from the emotional pain. So ice will do that, and it's a safe way, and it can be an intermediate step to get people away from self-mutilating and self-cutting. So you want to develop self-soothing techniques, bubble baths, things that favorite blanket, stuffed animals. A lot of people have stuffed animals and feel real ashamed about it. I have a chair of stuffed animals. And when I go out of town, they become transitional objects sometimes. People take them home. And it's really good. And then people bring me, as parts integrate, they add to my collection because the parts donate their stuffed animals to me as they integrate. And they know that they're going to have a good home. The purpose and function of self-destructive thoughts and behaviors, there is a purpose to that. As I said, There are lots of reasons why people do that, and you need to find out why. Always why. What is the purpose of this behavior? What is the function? Now, with mind control, if it's messages, and you know it's messages if they're being flooded and they're based on post-hypnotic suggestions or conditioned responses, what I will do with that kind of thing is, I want to cut, you don't have to cut. And I just repeat it. I have to die, you don't have to die, you don't have to die. May come up during memory work, or just may come up consciously. Another part of this is that if they're lambasting you and into this thicket of therapist programming or alienation from others programming, people are bad, this is the bad, that's wrong, whatever, I'll sit there and I'll go, and what else? And what else? And what else? And it drives people nuts sometimes. However, it gets you through quickly. It isn't worth interpreting. It isn't worth spending time on. They'll let you know. So you say, and what else? Well, you know, little kids, a lot of times, they just want to tell you something. They don't want you to solve it or discuss it at length, right? I mean, I've had one child, and he would just come in, Mommy, Mommy, crying, whatever. He'd tell me, and then he'd be fine, and he'd go out. It's the same thing. So the and what else is a really helpful thing of getting through a lot of messages quickly. Decreasing and stopping self-destructive thoughts and behaviors. I have used contracting with this sometimes in terms of, and it's the core birth personality's responsibility, because one of the things that I know is that if the core birth personality absolutely does not want something to happen, it will not happen. There is an implicit permission given, and I've talked to a lot of systems about this and a lot of kids. And for example, if someone cancels appointments and the kids bring her to therapy, okay, it's because she wants to be brought. I have a couple clients that do that, and they always come, okay? But once or twice, they have absolutely said, I can't do that. She really doesn't want to come. It's given me the clue. They do subconsciously what she wants. So the core birth personality really does determine. And so I contract with the core birth personality and with as many people as possible. But it's the systems are so complex, it's really hard to do that. But it really is the core birth personality responsibility, and that's another concept that's real hard. She is responsible for her own safety, her own behavior, and whether she dies or not. I've learned this through hard experience, I can tell you. And I find by taking that stance, yes, they'll fight you on it, but they know it's right. I can't keep people alive. It will kill me with all the phone calls and the hours and the panic and all the rest of it. I just can't, and it's not within my power. And so that's another concept of making them responsible or taking the real responsibility, because if they know they're responsible, that's part of beginning to make choices. Because when you think of mind control, everything was controlled, including their lives. And the fact if they stayed alive or they died. So by saying, you are in charge of this now, it's a really liberating kind of thing. It really is. I also form a lot of hypotheses. I'm always asking questions. Because again, I have to get the information from the person sitting in front of me. I don't know. So I ask a ton of questions. What is that related to? What is going on? What's the purpose of this? What's the function of this? I hear a set of symptoms. Okay, what's going on? Who's blending? If the core birth personality comes in and is on all this body pain, I know someone in the system's blending. Who's blending? And what you want to teach is that they can step back. This is a containment strategy. They need to learn to step back. They don't have to blend with the core birth personality. Now, for some people, what you can do is have the core birth personality go into the safe place in a room, surrounded by light, where nobody can blend with her. Not everybody can do that. But that is one way of containing that. And let me just say a little bit about the switching place. Did you know there's a switching place in the head? that every DID person, DDNOS, has a place where they switch. And the switching place is the place where if the core birth personality is out in the body and an alter stands beside her or him and starts to blend, that's the switching place. It's an actual place. The researchers messed with this big time. You will find bugs in there, little bugs running around on the floor. Now, we know what they were meant to be, listening devices. So you need a bug stomper or someone to get rid of those. Yeah. The switching place? Okay. How you find the switching place is you have the core birth personality come out into the body and an alter stand either behind or beside her and start to blend. Where the blending takes place is the switching place. In the switching place are cameras, bugs, torture devices, all kinds of stuff. They can clean it out. You need a bug stomper because they have little bugs running around because little kids hear bugs and that's what they thought of. And so you get cobwebs, Satan, whatever, skeletons, whatever. They need to clean that out thoroughly and keep it cleaned out, yeah.
Why are those bugs in there? What is their purpose for cleaning?
Well, listening devices. They just called them bugs, but the kids interpreted it as real bugs instead of listening devices.
Okay, but don't they want the switching to be taking place?
Oh, this is stuff that was suggested by the researchers that was in the switching place. The researchers doing the mind control suggested to the kids there are listening device, there are bugs, there are cameras, there are skeletons, there are this in your, they knew about the switching place. Oh, it's an actual room inside. To keep, no, to keep things dysfunctional, to keep them scared, to keep them dysfunctional, and also to make the core birth personality stay away, so that's always alters relating with the world, and also to make people sick. The other thing, in the switching place, okay, there are also lots of holes in the floor, and there are holes in it. And where the holes go to is where the altars stay. The altars stay in a place, and I guess we're calling it a matrix. And basically, they started at the age of 3 with a very simple matrix, and the simplest one is a tic-tac-toe, 3-dimensional block. And in each of those spaces resides an altar or altar system. And what they would do is each altar was given a number and a name or letters, okay, and given a designated place where they had to stay in their rooms. They couldn't talk to each other, they couldn't communicate with anybody, and they had to stay in their rooms. All right, and it started like that. Now, there are more complicated ones, and I'll talk about those. But, so you have this 3-dimensional thing. That's where the altars come from. Within, and then when they started with a simple one at about the age of 3, by about the age of 12 or 14, it was much more complex. We find Kabbalahs, the Kabbalistic tree, which is the triangle with the lines with the circles, okay, you know, that connects. And that was an early one, but it was too complicated. There's people that have it, but their altars in the lines and in the circles, that's where they live, or where they stay. There are decahedrons, which are like giant crystals in each facet. There are, one of my clients has one that's just a scrambled mess like spaghetti. And they suggested to her that it was like spaghetti. You find upside down triangles. You find all kinds of shapes. How they put that in is they would project an image on the screen like this, and then they would put electrodes on the face where they wanted them to think it was, and move the screen closer and closer and closer while increasing the pain until it disappeared into the head. And that's how they convinced the kids that they had this place inside of them. Now, they changed it. Kids changed it. And basically what they did was they were told, do not come out of your rooms, ever. And what would happen is the altars or the parts would be tortured or hurt or raped or whatever, and then they would, in the middle of that, would go inside to their place in the matrix. So that when they come out, guess what? They come out in the middle of a relive. Now, how do they do that? That's because and I don't know how many of you have been around a long time, but you know those spirals that we used to see on SRA drawings? Those are elevators. They belong in the matrix. They're elevators. And they go directly into the switching place. So that what happens is somebody's triggered out inside, or they could call them out because they knew their number. And so what they would do is get on the elevator, spiral up into the switching place. Well, if they're in the switching place, they are right out into the body. So any of those connections, there'll be 1, 2, or 3. You move away from the switching place into the safe place. They can move this around. Okay? So it's a tunnel, basically. So you move it. And what you do is you put a waterfall over it so they come out into water, which kind of cleans them up. And you have a kind of warning system so that the helpers, one of my clients put a computer there with a greeting. Greetings, welcome to so-and-so system. And it gave time then for the helpers to get there. And then what they would do is, as the alters came out into the safe place, take off all the electrodes, whatever was on them, clean them off, get them into the pool, and then get them into the safe place. Okay, this is a really good containment strategy. But then you don't have people coming up in your face and out into the body doing destructive stuff or uncontrolled flashbacks. Another part of this is that you will find black holes that come up into the switching place. And again, if a black hole appears, and what a black hole really is that either an IV with a slow drip of medication that slowly made them unconscious, and they would fade away into nothingness, okay? And sometimes you get that effect where the core disappears or alters disappear. It's a memory of that. And what you do with black holes is you fill them in from the bottom. Just fill them in with dirt, cement, whatever. And make sure you get all the alters out, though, because you can't fill it in if there are any alters in. So you just pull all the alters out. It's happened to me in my office where someone has literally fallen on the floor, being pulled into a black hole. And I just pick them up and pull them out, and it's just pulling you out, opening everything that needs to be opened up, pulling you out, pulling you out. You can do it over the phone, too, if someone's having trouble. Pulling you out, pulling you out, pulling you out until they're out. Or if you're talking to someone on the phone, they start to fade, they're likely going into a black hole. You fill it up and pull them out. And then that's real helpful. So that's the switching place. So that's a really important containment kind of, and this is something that's real different than what we have talked about. So that helps with the containment and pacing of flashbacks and memories. Another way that I do that is, basically, you can, and I do this initially with them in my office, but I give them their twice a day. In the morning, when people are in their showers, water pouring over them, they're to do an inventory, looking for kids that have come up during the night, cleaning themselves off, taking off any electrodes, anything, things out of their ears, and I'll literally go up to someone in my office. They'll be talking about the radio playing. Well, let's get that out of there. And I'll just put my hands like this and pull. Okay? Now, the reason that works is because at some point, whatever was in their ears got taken out. It fast forwards the memory to the end. Now, the reason that works is because at some point, whatever was in their ears got taken out. It fast forwards the memory to the end. Or if the electrodes are on them and you take them off, at some point they were taken off. Okay? Needles. Limbs dislocated. I have literally taken someone's arm and just given a little tug to put it back in. And this imagery all really works. So they are to do that in the morning, is do a complete body inventory, cleaning out anything in their nose, in their mouth, in their ears, around their neck. Sometimes there's stuff choking, anything on their bodies, inside their vaginas, or anything around that area, off their legs, off their fingers and their toes. Because what they would do is put electrodes on the fingers and toes, play the messages at night and shock them awake, and that's sleep deprivation, and keep them awake for days while planting these suggestions in their minds. So you take all that stuff off, and I have them do it. And if they feel, in fact, I have one client that they used to put in this, she's a very creative artist, and they wanted to convince her that she couldn't draw. She's now beginning to be able to draw, but she's 53 years old and been very frustrated because she couldn't. But she had this thing where her fingers would curl, and it was a memory. So what we did is she learned how to get out of the suit that they put her in that would then jerk her fingers down to convince her that she couldn't draw or that she wasn't creative. Stuff like that. Physically, because they'll visualize it. And then the helper alters can help the ones that are coming out of the matrix, and then once they're all cleaned off, they go into the safe place. Okay, now sometimes they'll go there when they're finished, and they may give in the process their memories or information to the core birth personality. A lot of times what we'll do is wait till later, okay, because we need to get stuff contained, and we need to get people functional. They do the same thing at night. They do the same thing if they have any kind of body pain or body symptom during the day. What is it? What is going on? Very non-leading. I'm not telling them anything. What is going on? And then they clean off whatever it is. And that's become a really, really good way of doing this. The other thing is you need to listen to the client language, how they describe stuff. Not everybody can talk to you verbally. Sometimes they have to lie. It's part of their job. So I learned a game with one of my clients. It's called the game of opposites for people that have to lie to you. Tell me exactly what you do, what you want me to know, and put a not in the sentence. And so it's the tone of voice. I don't want you to know this information. Telling the truth, they're lying to me. They want me to know. Or it's not dangerous at all to go to that place. And then what happens, and sometimes you can say opposites. It's not dangerous to go to that, or it's too dangerous to go to that place. But it's a way of communicating. I have one client that went through a period where she had to be silent. 2 hours. 2 hours she had to come into therapy and not say a word. It was a job, somebody's job. So what this part did is brought in, I have a tape recorder, spent I don't know how long putting together music on a tape to tell me what I needed to know. It's okay. No one said they couldn't play music. Okay? It was incredibly creative. I've had people write to me, journal, draw pictures. All of those are ways of communicating. Nothing is accidental. They're always trying to tell you something. And if you don't get it and you're being stupid, that's okay. They'll keep telling you until you get it. Because therapists can be awfully stupid about this stuff. Because I know I'm being stupid, but I'm not getting it. You need to give me a little more, whatever. And then eventually, of course, they don't give you any information. So that's really important to catch their language and how they talk about stuff, and to just keep asking. Management of transference and countertransference. Transference does show up. I mean, if they have a bad relationship with their mother, that's going to show up with you. If they have a monster mom and they want to scream at monster mom, guess who gets screamed at? It just goes with the territory. Most of the time, I'm really patient with it. Sometimes people will hit a button, and I'll get angry, but that's okay too, because I'm modeling appropriate anger. People are amazed I don't immediately fly into a rage and beat them up, but I don't. Very patient. Countertransference is difficult. You really have to. In fact, what I do a lot of times, and now I'm a lot more familiar, but you can imagine in the beginning with no one to talk to how difficult this was with all this behavior, all this stuff going on. But I have just learned to hold my breath and to take note of my natural reaction, which sometimes is really angry and really upset and thinking, oh, what am I doing here? Why are we doing this? On and on and on, because that's how I'm supposed to feel. And I know that's how I'm supposed to feel. and then I'd be very patient. Very, very patient, because we're going through something really important. And a lot of it is somebody has a job to distance me, or to distance the people in their lives. So you really have to manage, because every single button, you have to know your countertransference issues. I have a peer support group that we've been meeting now since about 1982. And we know each other really well. And we really get into countertransference stuff, but you need that. I get confronted all the time. And a lot of my, countertransference is the feeling that the therapist has for the client. Okay? But you really need that, because so I really care. And sometimes I care too much. And I really get confronted about that. And what I mean that is caring too much to the point where I'm beginning to get vicarious post-traumatic stress, when I'm starting to get nightmares, when I'm starting to cry, when I'm starting to really be affected by the material that I'm hearing. I use my peer group to confront me and get me out, and they really do a good job of helping me stay grounded. We meet twice a month now. And some of them are beginning to do this kind of work too. So we provide a really good support for each other. Time. Basically, I plan sessions with my clients. I don't have unplanned generally. Well, almost never happens anymore now that I know what I'm working with here. But I plan sessions, but they are longer sessions. Minimum an hour and a half. It takes a lot of folks, and this is with most of my DID clients, whether they're mind control or not. It takes usually a half hour to get settled down, and then we get an hour of work. If we're working on something really intensive, it can take a lot more, 4 hours sometimes or more. And so what I do is we plan ahead of time what we're going to do, and then we stick to the time. Don't tend to, and occasionally I have to have an unstructured time, so I have a Tuesday night that we can work without a time. I mean, I have that time period where people can rotate in and out of, because sometimes there are people that need to do, if they start on a series of memories, if you find that you start on a series of memories and it keeps looping back to the beginning, what you have is the core birth personality isn't getting the memory. You have an alter doing the memory work. Okay? So you need to be sure that the core birth personality is present. But it means sometimes that you really have to pace the work carefully and allow breaks. Don't drive people into the ground. It's really difficult work. But even in this stage, we plan pretty much a lot of times what our sessions are going to be. And I think that that's really important. Again, that's a teamwork. And that's the concept of teamwork. And it's real hard for some of these clients to understand. I mean, they get really angry about this teamwork. You're supposed to, in fact, I have a client right now who left my office on Tuesday basically saying, you're supposed to be asking the questions. This isn't therapy. She's getting better. But she wants me to take responsibility, and I won't. Unfortunately, her previous therapist did. I mean, 2 years of asking questions and dragging stuff out. I'm not going to do that because that's not good therapy. Doing reality checks. Reality is really distorted. People can contact me through my machine. I don't wear a beeper. I worked at a psychiatric hospital for 2.5 years. I don't want to be on a beeper. I work really hard. And I am not going to be at anybody's beck and call for 24 hours a day, 7 days a week again. And it works fine. People can leave as many messages as long as they want to on my machine. I will get back to them. If it is a real emergency, they have my home phone. I have been, in the last 5 years that I've been in private practice, I've been called at home maybe 4 or 5 times, which with this population is phenomenal because I have a lot of DID and trauma. I mean, my practice is practically all trauma. But they really respect that boundary, and I'm real clear, only in the direst of emergencies. But they can leave as many messages as they want on my machine, and they do. And that's great. And I listen to every single one of them and take them seriously. And I always listen to my tape before I go to bed at night. And my agreement is if I can do it, I'll call them back at least by the next day if they need to talk to me. But a lot of times it's just little kids telling me stuff. They just want to say, this happened or this information or whatever, and I don't have to call back. You want to also, there are lots of distorted perceptions, and this is good therapy stuff. Just keep confronting the perceptions and working with the perceptions. Let me see. A lot of the treatment is management of shame, anger, and sadness, and especially in the mind control, that's what they hit at. Trying to make people feel responsible, trying to make them feel ashamed, it's your fault. One of my clients is just going through a series where if she looks one way, she sees they use a lot of movies. She looks one way, she sees films of the Holocaust victims, emaciated, being tortured, horrible pictures on this side. If she looks the other way, they're really erotic pictures of people having sex while they're sexually stimulating her. What a choice. And because she chooses to not look at the Holocaust, she's told, you're choosing to do this. See, it's turning you on. It's your fault. At the same time, reading the Bible to her and brought up in a very strict Catholic family, bringing in priests and nuns and all of this kind of stuff. And then reinforcing the shame, because most survivors of any kind of abuse feel guilty and ashamed and that it's their fault. And they really hit at this. So a lot of this is management of shame, anger, and sadness. Anger's tough because they got severely punished for being angry. One of my clients who was in a facility in Colorado, in fact, two of my clients were in a, it's interesting how the corroboration of the facilities and the details comes. But she talked about, she really went out of the box with hysteria when they first started with her. And they duck her in water tanks to calm her down and half drown her. And then as she got more calmed down, but she would really get angry at what they were doing to her, they had a decompression chamber someplace outside of Denver. And I have two clients that talk about this decompression chamber. I don't know if it's a medical facility, but it's attached to an Air Force base.
Oh, okay. I thought that was a treatment place. I was hearing this.
Well, this is where they were children brought with the mind control stuff. Anyway, they both describe a decompression chamber, and what they would do is put them in it and reduce either increase the pressure. Do you know how much that hurts? Or decrease it. So there wasn't any air in the chamber. Pump the air out so that they couldn't breathe and had a difficult time breathing. And one of my clients describes it, it's like your lungs feel like they're stuck together. And that's what they told her. Her lungs were stuck together. So the issue of being at fault is a big one. Attachment to the perpetrators. God, there was so much done to attach them. The doctors are your friends. We're the ones that know you. We're your family. We love you, especially since one of the criteria was to pick kids from abusive families or neglectful families. They're already abused at home anyway. And I think parents were instructed to do abuse. We're the ones who love you. We're your family. A lot of SRA kind of stuff there. Safety. Now, a lot of the safety has to do with where you see the control. Are you in control in your own self, or are you being controlled externally? And this is the issue, too, of responsibility for safety. And you really got to deal with this one, because these kids have been taught that there's only external control, that they can have no internal control. Okay? So that's something you really have to work with in terms of the responsibility for their own safety, that other people don't control them. Okay, now, in talking about this, the other thing that you want to do, and the concept of the whole treatment of this as we move into, we're going to talk about doing memories and what this is all about real briefly. The concept is, we talked about how each of the alter or alter systems is in the matrix. So how you start all this, and I was told wrong, basically, and all it did is succeed in flooding my clients and exhausting me for 3 months until I just, started setting limits all over the place. Normal therapeutic boundaries and limits apply. I had to learn that. But normal limits and boundaries apply. But anyway, your task is to get every single one of those alters out of the matrix and into the safe place. How do you do that? One of the secrets in the system is that as fast as people were being put in the rooms, behind it, they were building tunnels and caves and mazes to connect everything. Okay? That's the working place, because what you're doing then is you're working through the maze, going through, however, and getting all those kids out of the matrix and into the safe place. Now, into the safe place can mean that they automatically integrate once they've done their work, or it can mean that they stay on to be helper alters, or whatever it is job that they take after that's completed. But that's the concept. One of the things that I learned to say to people, and it seems to make sense, is, before we start this, turn it upside down, cut off the top, and bury it as deep as you can. The reason is, when they finished the quote programming, and they put a cap on it, and it was something so horrible that no one would ever want to remember it. You don't want to start with that. So whatever shape it is, if it's an upside down triangle, and I'll use that one, if it's an upside down triangle, and you start at the end, the broad end, if you tap in there, which is where I did initially, what have you got? All those memories that start flooding in that layer. And it is in layers. They layered it by degree of trauma and degree of pain in the mind. So what happens is you turn it upside down so you have a regular triangle, cut off the top because there's serious trauma, poison, as one of my clients said. Bury it as deep as you can, because that's the last thing you're going to do. And then you start where it makes sense. This isn't leading. I mean, if someone didn't have mind control and you said that to them, they're going to look at you and say, what the hell are you talking about? You'd be amazed. People go, oh, okay. And then they think about it and they do it. So then, you know, that's more confirmation. But, and then I say to start, so that things my clients have said to me have been, oh, you mean start with the little big memories. Oh, you mean start when I was old enough to understand what was going on. Oh, you mean start at the point at which I was beginning to understand. But they will determine it. They know where to start. And again, you're working through the maze, getting all the kids out and doing whatever it is that you have to do, and they know. They're the guides. They're the ones. I don't know. I can't tell you. I can't direct this. So, and getting them into the safe place. So then you're set up and prepared. The other thing you need to know about DID too, you have an internal system that is only internal, that does not interact with the outside world generally. They can, but they don't. You have a bridge parts, which are few, who can pull out inside parts, and you have outside parts that just deal with the outside. The CEO, parts that go to school, but they're not generally trauma. They may carry trauma, but they're not as traumatized as the ones inside. Your bridge parts are the ones that are the most helpful because they know who to get, and they're the guides through the matrix. Okay? And that's a real important concept to conceptualize. You don't even have to talk about it. It's automatic, but you need to have the conceptualization because it's real useful to know who the bridge parts are, and they'll become apparent because they're also the ones that there's a historian who know everything, and that's something else. Some part watched everything. Some part watched everything. So no matter what happened, my answer is, yeah, I know, somebody knows, but it's true, somebody knows, even though they were told not to watch and not to communicate inside. Move to the mind control. No, keep going. I'm going to skip over this stuff. Medical, experimental, etc.
Here it is.
Okay. All right. Now, I'm going to talk real specifically, and we're going to talk about memories. I have guidelines when we get to a stage. Now, all this stuff we just talked about in terms of the containment, twice daily practicing containment strategies, okay? All of that kind of stuff is preparation. That can take a long time. Normal therapy, we're not even into memory work. We're looking to control it and to deal with it. Unless I have somebody who's been in a lot of therapy and been through those stages of therapy and has it down and is pretty functional and can contain, I don't move into doing memory work. Now, I have several guidelines in terms of how I do memories. Number one, we do not have to do every memory. Number two, we need to plan sessions. And so if kids are coming out of the matrix, we're working through the maze, they give their memory back to the core birth personality or whatever it is that they carry. Not everyone has to do it. Okay? Some just have to come out and be cleaned off. But there's important, and when we do memories, we are looking for information. What is the information we're looking for? We're looking for information on what they did. It is not sufficient to just cathart a memory or abreact a memory. There's always something that we're looking for. Post-hypnotic suggestions. Do the next one because I can. Wait a minute. Do I have that? Yeah. Okay. We're looking for. Okay. We're looking for these kinds of information because when people remember what the people actually did, they undo the programs. And one of the most profound things, and I'm realizing now how profound, and I have struggled for almost 4.5 years to figure this out because I just did it so naturally, and my clients have accepted it so well. Programs are memories. For those of you working with this, think about that. The implications of that statement. Programs are memories. Therefore, what I have found is that regardless of what you're dealing with, it has a concrete physical basis then. Something had to be done to this child to make them behave, feel, and I'm going through the Bass model, behavior, affect, sensation, and knowledge, behave, feel, sense on their bodies, body pain, and know what they know. So everything is memory. So if you're working with, quote, programs, if you're working at the level of decoding and getting codes and doing all of that, unless the person tells you they have to and that it's necessary, and I'm not ruling that out, but generally I have found that that's not necessary, that we're working at the level at which the researchers wanted us to work. We're also, I think, dehumanizing our clients. So what I'm proposing is grounding this back into our treatment model of memory work, and really good, solid memory work. I will not do memories unless I have some idea of what the memory is going to be. I don't go fishing. It has to be somewhere, somewhat in conscious memory. We plan it. We know generally, not always, but generally, we know pretty much what alters, in fact, I have clients who write it down. I have another client who just comes in. She knows how much she has to do. She gets on the couch. The alter gives the core birth personality the information about what happened, because if what experience now has a concrete physical basis then for example, if you have behavior modification techniques that taught alters how to do certain things, and you go back and look at what actually was done, then you don't have to do it anymore. If you have classical conditioning and you see how behaviors were linked through aversion or repetition or whatever, you don't have to do it anymore. And that's what we're looking for. What did they actually do? Give you an example. At this conference last year, I was talking to a survivor, and she said to me, what happens in the brain when you have blue out of this side and red out of this side? And she'd been walking around for months, seeing everything out of a red filter in this side, everything out of a blue filter in this side. And I automatically just said to her, what do you see? And she'd done all this research on brain chemistry and neurology and searching through, really seriously looking for physical condition. And I said, what do you see? A little voice comes out and says, oh, we're looking into, like the thing in the eye doctor's office, and it's a blue lens on this side and a red lens on this side, and that's what we're looking into. And I said, well, what would happen if you looked away? I never thought of that. Looked away. Oh, it's gone. I said, well, you don't have to look at it anymore. Oh, okay. Core birth personality came back, and she'd been dysfunctional for 3 months, not able to read, not able to work, not able to drive because of this. And so if you're dealing, or I have another client who kept choking, and she'd been in therapy with a previous therapist who really did a mess. And basically what she did was she was choking, and the therapist did interpret it for her without asking that it was a penis in her mouth and it was oral sex, et cetera, et cetera, et cetera. Well, I don't assume anything. So I just said, well, what is that associated with? Or what does that remind you of? She thought a minute, and she goes, oh, God damn it. They put a sock in my mouth. And it was a sock, and they were trying to choke her to make her anorexic. There were other incidents of other things, but that's what it was. So you cannot assume that you know what they're telling you about. So ask. They used a lot of hypnosis. A lot of the behavior that you see today is the result of post-hypnotic suggestions. Well, I'm trained. I went and got training in hypnosis. I mean, I've gotten a lot of training over the last 5 years to help me deal with this. But I don't use hypnosis to look for memories. I don't use hypnosis to look for memories. I don't put people in trance. These clients are very good at doing it themselves. They're very highly susceptible, and they just do it. If they're ready, we have the conscious memory, or at least something about it. They're the ones that then, if they go into trance or not. I have clients that don't have to abreact. I have clients where the alters just tell them, or they just close their eyes and get the information. Then the alter goes to the safe place. I have other clients that have to do full-blown abreactions. And it's just, it looks like it has something to do with individual personality and the way that people learn. Some people need to totally experience things. Other people need to visualize. Other people need to hear it. So in terms of hypnosis, so you need to know hypnosis in terms of managing trance and knowing what you're looking at. The other thing is that you need to counter the post-hypnotic suggestions, because a lot of times people go into trance, and at some point when they're recalling the memory, they will go, you have to die. And I will say, you don't have to die. Now, it's do not die, whatever. It's, again, you don't have to die. You don't have to cut. It's okay to sometimes don't remember. I'm one client that goes, destruct, destruct, and starts choking herself. And what I say is, do not destruct, do not destruct, do not destruct. And then after a while, she picks, she says, do not destruct, okay. And then, she kind of goes back into it. So you find a lot of those little nasty post-hypnotic suggestions. I have another client that has a whole litany of all the things that she's supposed to do to commit suicide. In every memory, it's called a meta-level program. And we undo those each time. And just keep repeating, you don't have to, or don't do, or whatever, and you just keep repeating it. So you're undoing post-hypnotic suggestions, which can be very enduring. Next, they use drugs, and one of the ways I deal with drugs is I just tell people they don't have any drugs in their system right now. You can clear your head. Because the memories will be kind of fuzzy, and that's okay. They just need to get the information that they were drugged and get a sense of what the drugs did to them. Tricks and traps. There's a lot of double-bind stuff with this. Unbelievable amounts of double-binds. I had a client who they put in chains, electric shock all over her body, and they'd open the door, and they'd say, you can leave if you want to. All you have to do is just walk out that door. So she'd start to head for the door, because she wanted out of there, and they'd shock her, and she'd fall down, and then they'd say, get up. Get up. It's obvious you don't want to leave. You must really like it here. Have you ever tried to get to your feet with your hands tied behind your back? It's almost impossible. And being shocked? It's very difficult. And then calling her a wimp all the time. There's a big issue with her being a wimp. She's not a wimp. But I had to keep saying that. You're not a wimp. You're not a wimp. You're not a wimp. Countering all of those messages in any way that I can. Another way, tricks and traps, is when alters come out with really aversive behavior or doing things that look like one thing but it's really something else. I had a client, and this is before I knew she was mind control. She got out of the hospital, and I was seeing her in one of the hospital whatevers, and Alter went to the kitchen and got a butter knife and barricaded me in the room with the desk. And this Alter is male Alter, and a female client is sitting there. And I just sat there until the session was over, and then I got up and said, okay, you can give me the knife now. You've done a really good job. Oh, I have? Okay, gave me the knife, and that was the end of the session. But if I didn't know what was going on or intuit or know this client, that could have been really serious grounds for termination. But I did not. I mean, obviously she's still my client and doing extremely well. But there are all kinds of little things that you need a sense of humor. I mean, my clients, we laugh through stuff. I remember one of my clients doing this horrible memory. They pricked her all over her body with needles and then poured alcohol on her. And then we're putting told her they were peeling her skin off and they were eating it. And something didn't quite, sometimes things don't quite fit right. And I'll say, look at that again. What are they really eating? Because I'll say that a lot if it doesn't make sense to me. What are they eating? Chicken. And what it turned out was they were having lunch. There was a bowl of chicken on the table. I mean, this is so disgusting. There was a bowl of chicken on the table, and they were having lunch while they were, and pulling the skin off the chicken and persuading her that it was off of her, and pouring ketchup on her to make her think it was blood. It was so cruel. I mean, but this is the mentality of what we're dealing with. But that became, because we just both cracked up. I mean, it wasn't funny, but when then it became, then, is this another chicken? And so you can develop that kind of private language, which teaches them intimacy as well. And it develops that feeling in terms of your own language with each other. So there are all kinds of things that can come up. Another trick can be an alter that comes out that doesn't know you or doesn't know the rest of the system. And what is this is an alter persona type program. And really what it is a part that wasn't allowed to know that there were other parts inside and that was put away totally, absolutely isolated with lots and lots of amnesia for the system and whatever. Now that part can be fully developed. I haven't encountered it fully developed. I've encountered it, who are you, lady? I'm going, I'm Valerie. So, and they really don't know who I am. But there have also been reports of alter personas that have been so well developed that they have a whole separate history from the person that's in your office, and that if they get access and flip to that person, that's where sometimes therapists, they just don't know who the therapist is or anything that's going on. So that can also happen. And when they begin to remember, they realize that their history was manufactured. Could you imagine if you thought that you were you and then found out that you weren't, that you were really part of a DID system? I mean, this is what the experience is like. Also dealing with blocks. Blocks can be cursing you out. If I get cursed out, you goddamn motherfucker, what are you doing messing with it? I'll say, okay, what else? Or what I may say, I'm really good at this. And then what happens after a while is people will start laughing, you know, because they know it's coming, and then we can have fun with it. It becomes a game. Or what I will say with other of my clients, and again, it's very individual because different people deal with this different ways. But I have another client where that happens, and I'm basically what I say to her alters are, I am so sorry that you hurt. I am so sorry that you hurt. And I know you're really scared, and I know you're trying so hard to protect, and you're doing a really good job. And what happens is, and I really believe this, by the way, when I say you're doing a good job, I mean, I really believe it. And what will happen is that they'll start to get teary. This is a client I met in the hospital when I worked in the psychiatric hospital, was in the hospital 9 months, spent 45 days in the quiet room. And because she was so out of control. And what I noticed one day, because they'd strap her down, and what I noticed one day is that she would be fighting, and it took like 8 people to get her down. I mean, she's this tall, but she's big and tough. And I noticed that even though she was swinging, this is as close as she came to anybody. All right, so there was some thought there, some control there. And then I started talking to her alters. This is before I knew about mind control. And she is mind control. But what happened was, what she was doing, what her alters told me was, she learned the only time that she ever got hugged or touched was when she was being abused and held down. She was recreating it through her behavior. Being held down, it was better than, so from that time on, I forbade restraints with her. And basically I would go in there, or 2 staff would go in there and let her do her thing, keep her safe off the walls so she couldn't hurt herself. But she never got put in restraints again. And we developed a signal, because she couldn't ask directly, where she would pound on the wall if she wanted a hug. And so the whole staff got into this. I was clinical director, so I could do these kinds of things. But the whole staff got into, if the wall got banged, she got an instant hug, and it was so healing for her. You know, but those are the kinds of things that you can also do. But that could have been really disastrous. Even outpatient, for a little bit, they would try to fight with me physically, and I'd have to restrain. And that's something else, is if people are doing memories, a lot of times, people will try to bite, they'll try to pull their hair, they'll try to punch themselves, they'll try to choke themselves. I am right on top of it. And I make sure that they are safe. The other thing you got to watch, too, is they will contort and get into positions where limbs can become dislocated. I am very, very careful to make sure that does not happen. Okay? I have no compunction about doing electric shock flashbacks. There's no problem with that. I have taken pulses. In the beginning, it was real scary with the convulsions. But the reality is, it's like a block. The pain, they have to go through the pain in order to get to the information embedded in the memory. Once they get the information, they don't have to do anymore. But sometimes they have to go through the pain. And, but I make sure that people are safe. I mean, I literally follow them around like this. I may not be touching them, but I am literally, if they're going around the office or on my couch, I am right there. And I get their permission. And that's the other thing, is if I touch anybody in any way, shape, or form, I always get their permission. Never, ever, ever touch anybody without their permission. I do it. I can see someone for 8 years, and I'm still saying, would you like a hug? Is it okay if I touch your arm? Because sometimes it's not okay, depending on what's going on. And I think this is extremely important. It empowers them as well, because if they don't want something and they can tell you no, guess who else they're telling no? So it's very healing, but that's very important. Another thing is disinformation, where they use time distortion. They try to mix people up, planting disinformation through post-hypnotic suggestions. One of the things that I have come across in some of the memories is when they traumatized somebody and then did electric shock to wipe the memory and create amnesia, they also would, when the person came out of it and didn't remember, had to give them a story. So they created a cover story, which I guess would be like a screen memory. And I have run into screen memories. Some planted, some not. But basically, I had a client who thought that she'd been in all these car accidents because she was drunk throughout high school. Guess what? She was not drunk, and she was not in car accidents. It was because of being in experiments that she was constantly being hurt. So, you know, those kinds of things become apparent. So there is disinformation, and one of the biggest disinformations that can happen too is people are told that the President of the United States is involved or whatever. Sometimes people are involved that they say, but there are also people that were not involved. So it's real hard to tell, you know. But every president since, before that, every president has been named since the late 40s as being part of this. And I think there are some that were, but I don't think all of them. And then the psychic driving is another technique where, and basically what was involved in this is the one where electrodes on the fingers and the toes, weeks of sleep deprivation with messages going into the ears, or days, and then what they would do is take all that off, continue the messages, and keep them asleep for a couple of weeks. And it was to drive the messages in as deep as they could get. And how did they pick messages? This is important to know, too. They picked messages, because they were doing research on these kids all the time. They found out their greatest, deepest fears, the things they were most afraid of, the things that affected them the most, and that's what they used. So whatever that was, and it was different for everybody, which is why this is so individualized. Okay, and then that would get driven home with a lot of shame and a lot of difficulty. And so that's, can you do that? Okay, now I'm just going to go through these real quick. Remember, programs are memories. So in order to defeat them, if you go back to the original source of what they actually did, and think about the implications of this. They can make programming more sophisticated, but there's always a memory of it, what they actually did. And what we see is the behavior as a result, which is a memory. Behavior, feelings, sensations, and the knowledge is always the last to come. That's the order in which memories come back, generally, in my experience.
Say that again.
Behavior, feelings, affect, sensation, which is body memories, and knowledge. So the first thing you get is behavior, and what do we see? Behavior. Okay? But it has a specific thing attached. And the reason that when you say take off the electrodes, oh, just clean them off, is because at some point that did happen. And they just go to that memory. Don't have to go through the whole thing. They can skip to the end. It's there. Somebody knows. Okay? I don't know how to do that. Somebody knows. Also, one of the things you can do is if you're getting a lot of body pain, who's blending? Okay? Who is blending? Because you've got to teach them not to blend so much. And why are you blending? What's your job? What is it you're trying to do? The other thing is the core birth personality also has to periodically be cleaned off. You're cleaning off alters. You're cleaning off the core birth personality. If you say who's blending and you get a smile, no answer, but the symptoms don't go away with the core birth personality, have her stand in the sun and see her shadow. Someone check her shadow, like at about 2 o'clock. And if you see lumps and bumps on the shadow, what those are alters that have come up out of the matrix and are clinging to the core birth personality, giving her their memories. And so you get the helpers to peel them off because they're clinging for dear life. Clean them off, get them cleaned up and into the safe place. Yes?
Can you explain a little bit more about what you mean by blending?
It's when,
Disengaging.
okay, blending is, you have the core birth personality out in the body, and an alter comes and blends with the core birth personality, but doesn't come all the way out and take over. So they're in the background, you can't see them, and you don't know that they're there. The core doesn't always know that they're there, but you're getting all these symptoms, and they're symptoms of their memory.
Do you teach the client the terminology?
Yes. Yes, I do. As we go along. I don't bring up stuff before they bring it up with me. This whole model is really great in terms of non-leading, non-directive. If someone describes stuff to me or tells me stuff, then I'll give them information. But we'll do this. The safe place stuff is standard therapy stuff, you know. So I can tell them all that stuff. But anything specialized, they have to tell me first, and then I explain it. I don't go into it like I'm doing today. Yeah.
You said that lumps in the shadow are?
Huh?
You said if you stand...
Yeah, what you'll see is the shadow of the core birth personality will have lumps, and what those are is alters that have come up out of the matrix, and they're clinging to her, and they're blending.
We just have this last one finished, so if we could hold on
Yeah,
to questions
I want to get
for a few
through.
more minutes.
Okay, another part of this is alienation from God, therapists, parts, core, and others. A lot of the treatment is spiritual and dealing, and that's towards the end or whenever they bring it up, because they will. And there's a lot of stuff around. God doesn't care about you. You know, do you think God would really let this happen? And they really did hit at that. So black holes, I already talked about. Move them out of the safe place. If you've got a black hole effect, which is someone feels like they're disappearing, that's a black hole. You basically say, fill it in, get everybody out, fill it in from the bottom. If you can't find it, use spray paint. Okay, you just spray, and what happens is the black holes show up black. It works. Spin programs. Spin programs are when kids were put on tables, strapped down in the spread eagle. Every one of my clients draws those pictures, and the table was spun. Symptoms of spin programs are dizziness, nausea, disorganization. They feel like they're spinning. And I'll say, oh, that's a spin program. Just turn off the switch. And the thing is, at the end of the memory, these were electric tables that went around, or sometimes they were gyroscope or whatever. And so there's always a switch that turns it off or some way of stopping it, because at some point it did stop in the memory. Okay? And I have a client that kind of gropes, she thinks about it, gropes behind on the wall and turns the switch off, and it stops instantly. And again, it's a memory, but you want to get them to the end of the memory because they're coming out in a relive. Vortex, tornadoes, whirlpools, and these are like swirling things. And again, how you can tell the difference between a spin program and a vortex is that a vortex is a combination of a black hole and a spin program, if you think about it. Okay? They're slowly being put out while they're spun, so they have this feeling of being sucked down into something. And then if they have a movie showing of a tornado, that even increases the effect. All right? And this is how sophisticated some of this was. So what you do with this is, and other people have all kinds of ways of dealing with this, but one of the ways is to create a counter tornado or vortex or whatever, going the opposite way, make them merge, and it cancels it out. Body pain, take off the electrodes, take out the needles. Sometimes I have to do this with my clients, teach them initially, and then they do this a couple times a day. So the other thing is, it's really important to teach them the difference between body pain and real physical pain. So I always take them to the doctor to get stuff checked out. I have a wonderful doctor. Find a wonderful doctor who will take you seriously and not think you're crazy, and who will really investigate symptoms. But I seriously try to teach clients the difference, because a lot of times they do not know, but this is really important. So whenever they're really sick, this is physical. When it's a body pain, this is body pain. Now, I have clients that come in and say, I have a headache. Oh, and I'll say, okay, we have work to do. Well, Valerie, sometimes an apple is just an apple. And then she'll get on the couch and she'll do her work that she needs to do. And then, oh, the headache's gone. I said, well, I guess you had work to do. Lock in, lock out. Basically what that is physically they put a child in a box with a lock. Or behind a door in a room with a lock. Or some of my clients have had the experience of being bricked in or cemented in to a room. And again and again and again and again and again. Well, you know, these kids were trained to be spies, right? Well, we have lock pickers inside, so who's a good lock picker? And so we send in the lock pickers. They unlock the lock and get who's ever out, untie them. Sometimes they're chained to the wall. Sometimes they're hanging, whatever, but we get them out. You know it's a lock-in, lock-out when the core birth personality has disappeared and nobody knows where she is. Somebody knows she's locked in somewhere. And then whoever is locked out into the body. Or sometimes the core birth personality is locked out into the body and can't get back inside. So when you lose that freedom of movement, you've got a lock-in, lock-out program. Just look for the doors and the locks or the rooms or whatever. And again, you just ask them, where are they? Get the lock pickers. What do we have to do? Now, I had a client that was stuck in a room, and it was metal, and you couldn't tell which of the doors, where the doors were. I said, somebody knows because they saw the doors close. Okay, somebody knows. Okay. And so the person said, well, I know the door that we can't go through. I said, oh, which one's that? The one with the tiger behind it. I said, great, that's the one we go through. And, of course, it was. So whatever, and that's another part of this. Whatever they said don't do, then we better do it, because since when did they ever give you good advice or anything that would help you? And that's a good reframe. Split brain we've talked about, and there's more to that, but I'm not. Chutes are like ladders, and they're sort of related to black holes, where all of a sudden someone gets into this nest of suicide. They're doing great, and then all of a sudden they're suicidal. It's sort of like a black hole, but it's like a slide down. It's a chute. A slide down right into a thicket of nasty messages. And again, we just pull them out, fill it up, get rid of the slide. Serial programs are date-specific, where they literally, and one of the things to bear in mind, if it's mind control, and it can look SRA, and they used a lot of satanic ritual abuse imagery to confuse things and to make them think that this was ritual abuse, which is how they come to us. But the date specifics coincide with school holidays. School holidays. But they are also roughly, loosely around satanic holidays. Easter, spring break, before you go to school in August. Not Halloween so much, although that they did. Christmas time. So all of the, no, I guess there is a fall break sometime around there. So they coincide, or they may actually have gotten kids on the satanic holidays, if they were that specific. And then mirror programs are programs where it's like a maze of mirrors, funny house mirrors, and they're caught in it. And somebody actually physically went through this. And so all the distortions when they looked at the mirror, what you do with a mirror program, just dismantle it. You take the mirrors down, unlock them because they're all locked together, and just stack them up very carefully. Don't want to break them, and then just throw them in the sun. There's always a sun. Garbage disposal is the sun in the sky. And just throw them in the sun and get rid of them. So I hope I've given you a flavor of how concrete and literal. Just leave you with one of my clients was saying to me, I bet you have a lot of clients this time of year that are hanging by a thread. Well, my answer is, who inside is hanging by a thread? Okay? This is how you listen. And sure enough, there was a whole group hanging by a thread. So it's very concrete, very literal, really getting concretely to the memories, because that's how it ends up being undone. Okay. Thank you, Valerie, You're welcome. for a great packed program.
We've been listening to a presentation by Valerie Wolf entitled Assessment and Treatment of Survivors of Sadistic Abuse that she gave at the recent Believe the Children conference in Chicago in April of '97. You're listening to CKLN, the International Connection, and we're in the middle of an extended radio series on mind control, and this is show number 17, and this will be continuing until October of this year. Transcripts of these shows are available on the internet on the World Wide Web at the address www.mk.net/tilde, that's the little squiggly sign, tilde MCF/CKLN-HM.HTM. And you can call the station 595-1655 if you want to get that address again if you didn't catch it. CKLN 88.1 coming up next, aquí en Nuestra America. Stay tuned.